Welcome back to Morning at NTV. We're still on the hashtag Morning at NTV, and today we'll be talking about the current status of the healthcare system. Is quality healthcare system accessible for all? What structures can be put in place to ensure that we improve the current status? And today in studio, I have Dr. Charles Olaro, who is the Director for Clinical Services. Thank you so much for coming on the show.
Thank you.
I'd like us to start on...
Viewers.
Good morning. I'd like us to start on this point whereby you get to break for us the current structure in the healthcare system in Uganda.
Thank you. The government policy of health is to ensure that all Ugandans have access to high quality and affordable health care so as to contribute to socio-economic development. The national health systems includes all those institutions and structures and actors whose primary purpose is to achieve and to sustain good health. And in Uganda, you find that these institutions include the public, that's government, the private, the community, and the community I want to emphasize here is community is key. The private organizations, the faith-based, traditional and complementary medicines. So all those are institutions which are involved in, and their primary purpose is to achieve good health and sustain good health.
Okay.
In the structures of Uganda is that we are structured on the higher side. We have the national hospitals, of which currently we have 2 national hospitals. That's Mulago and Babika. Going down, then we have the regional referral hospitals. There have been 14 of them, but the number is going to rise to 17, and this will include the Kirudu and Kawempe and Entebbe hospitals. Those are coming on board. And then we have 158 general hospitals in the country, and we have 215 health center force and about 1,500 health center threes, and currently about 4,400 health center twos.
Okay.
So those are the structures. So if you look in terms of access, if you look at in 1997, the access to health services only stood at 47%. But currently, if you looked at OPD utilization, you have about 101.1, which means that each person has got a chance of using outpatients.
Okay.
And this has been because of a deliberate effort by government. Government has invested in the construction of health infrastructure so that the access, if you look apart from the highlands and probably the areas, mountainous areas, access should be at the moment, physical access should be standing almost 100%.
Okay, I hear you, Dr. And we have all these public health institutions that have been established across the country, which is a great stride on the government's part. But is it a matter of the government has chewed so much that it could chew on swallow? Because we are having instances, and I'm sure you attest to this, that most of the public centers actually are poor when it comes to service delivery, long queues, when it comes to inpatient matters. We've just had someone on the ground saying most of them don't have beds. Why are we having this case? Is it that the government has failed to finance adequately all these public institutions that it has set across the country?
Thank you for that question. Definitely, we have made inroads in infrastructure. We are subsequent definitely now moving to address those areas where there are gaps. And we, in terms of human resource, definitely the number of human resource, if you look at in 2011, we're only at about 57%. But currently the human resource staffing is at about 73%. In the year ended, we distributed about 7,000 beds and mattresses to all facilities across this country. So we are, and the budgets for drugs have subsequently been increasing. But what has been the bottleneck is that we still have a very high burden of disease. And this is why government has moved in that we have to address prevention. If we don't address prevention, it will still require extraordinary amounts of money, which as a country we might not be able to sustain. That's why government has put in control of malaria, the distribution of the net. We have just completed in March distributing about 26,000 mosquito nets. The prevalence of malaria
has gone down.
Currently, it is at 19% from about 42% in 2011. And in Kampala, it's only at 1%. So it means that it's scientifically proven that if people use mosquito nets rightly, then we should be able to reduce the burden of one. We have also rolled in now, the country have rolled in test and treat, and we have more than 1 million people who are enrolled on care. So we think that, and on side of prevention of mother to child, now less than 3,000 children are born with HIV from transmission for the mother. So those are all efforts which government has done, that those are prevention, immunization. And that's where we really argue that we want the countries to immunize. When we introduced the pneumococcal vaccine in 2012, it was able to reduce infant mortality from 54 per 100,000 to 43. And this year in July, again, we're going to introduce the rota vaccine, which we think that it should be able to address, because normally the children who have been dying because of diarrhea.
So prevention is actually key, and I'm happy that the government is taking, making strides in ensuring that we prevent, before we have this burden to actually have people go to the system, to the centers to get cure. But Dr. we agree that the current situation in the public institutions is dire and it needs to be checked. Is it a matter of us not having enough personnel? Because according to statistics, it shows that the patient practitioner ratio is 1 to 24,000. What do you have to say about that? Is it that we lack HR, the HR resource in most of the public resources is wanting? Is it a matter of we don't have enough doctors locally?
Okay, we have challenges of human resource currently, and we have challenges in terms of numbers. We have also challenges in terms of skill mix, and also we have challenges in terms of distribution, because the majority of the health workers and specialists are concentrated in urban areas. And then definitely that brings that the lower facilities don't have the doctors. But as a ministry, we're working around this, and we are working in a system where we want to get into scholarships which are tailored to specific facilities, so that as you go to school, we'll sponsor you for a scholarship for Navy. When you complete, you go back and work in Navy. We have also had challenges of attraction and retention of especially the specialists and doctors. But all, as you are aware of, that government is enhancing salaries, and we think that this will be one way we'll move forward to do what? To address this. We also putting in non-monetary incentives. The institutions, government has invested a lot of money in putting up staff accommodations in hospitals. So almost any facilities which we are doing, like if you look at in the coming year, we are going to upgrade 123 health center 2s to health center 3s in 99 local governments.
Okay.
And one of the components, in addition to laboratories, maternities, we will definitely address issues of staff accommodation, because we think that we really need to address, in addition to addressing monetary incentives, we also need to address the other monetary incentives.
Exactly.
And when we do this, then we shall be able to attract. We have scholarships for cadres which are constrained, like in numbers, like anesthesia, which we have made a deliberate attempt that we are going to sponsor them for this, and they are currently undergoing training in Bustema University and other
so you're
institutions.
sponsoring and also ensuring that the working environment is sorted.
True.
You have mentioned that the government is also looking into, revising the salary structures. How soon will that take course?
This is no longer something which is questionable. Come July, the health workers will have enhanced salaries.
There's been this debate about the Cuban doctors coming into play, but it has not yet, been approved by government. It's still on the stage of trying to be, they're trying to assess, do we really need it? Can we afford them? That's the question. But the local doctors are coming out to say, you know what, if you're bringing these Cuban doctors, why not pay us the same salary you're going to pay them? What do you have to say about that?
I think, as rightly you have put it, that this is the discussion which cabinet has not made a decision. But as you listen, I think yesterday you hosted the ambassador of Cuba.
Correct.
He clearly indicated that the Cuban doctors will not be paid any different from the Ugandan The Ugandan doctors. And what I want definitely to emphasize to colleagues that this is an additional human resource. All of you, if you observe definitely, truly, our facilities do not have the doctors whom we want. And as he has clearly indicated, the main areas of concentration will be areas which are hard to reach. So it's something which I think we should not really be losing any sleep on it. It should be something which should be able to do it. Yeah. I think there should be equity. So long as we should ask government to provide what we need for us, but at the same time, definitely as a government, it has got all this big objective to look at that. It's responsible to provide the care. And to provide the care, if there is any additional resources which they think that it can be able to help this, it's actually the right of a government, sitting government in power. I hear
you. There's this other issue about service delivery, and not just service delivery, quality service delivery. We've had instances whereby the public is actually shying away from getting, medical attention from public institutions because they say when they get there, they're treated in a very, inhumane way, especially for them that are require a lot of care. What do you have to say about that? Is the ministry putting that into perspective, training the medical attendants, not just in the medical bit of it, but how to handle patients?
Okay, we definitely want to empower our health workers in the soft skills of how they relate. But also, I want to mention.
So it has not yet taken course.
But many of them are ongoing, and okay. Most of it is ongoing. But also, what I want that some of these issues which keep being raised are historical perspectives. Because if an issue has happened even several years, people will keep referring to it. I also want to mention that the public health systems, there are more people actually who are attending public health systems. The recent survey actually indicated that about the first point of contact of almost about 55% of population is actually public health facilities. So we intend definitely to address this. That's why we have introduced the client charter, where we have clearly indicated the rights of the clients and the responsibility of the health workers. And also we have opened up channels for feedback, so that if we have cases like those, we should be able to receive the information and then they will handle them through our disciplinary process.
So right now, if you go to a public hospital and you're mishandled, then you have the right to actually raise that with management, and it will be taken up?
Yes, we currently, actually that's an aspect which I have added, that the public should be free to be able to do what? If there are issues, they should be able to take up with the respective management of the institutions. If they are they fail, then they can be able to address it to a higher level, and probably as a ministry, we will be willing to receive. We have a call center in the ministry. Unfortunately, I didn't come in with the call number, but probably I will avail it to you. We'll be able to share with the public. So we have a call center in the ministry which is able to receive all issues on human resource, issues of shortages of drugs, and if there are any challenges, the public should be really.
Is it toll free?
It's toll free.
It's toll free.
Yes.
Okay. The trust levels for the public when it comes to the health institutions and medications, the generic medications, has gone down, and most of them are opting for alternatives, the herbals, all these other options that are now cheaper and, according to them, are safer. There's been this issue of fake medicines being circulated in the market. What is the ministry doing to make sure that they nab people, or they stop this? Because you can imagine if fake medicine is in circulation, then the public's health is at stake.
Okay, what I want first that the public should have confidence in the health systems. And what you should know, actually, that most of those who initially go to the traditional healers and probably take these herbal medicines, what happens finally? If you follow it up, you will find that they end up in the public health systems when they are now very sick. When actually they have spent almost all their money, all the gods and whatever in these systems, and finally when they come into the health systems, all the money is what? Is completed. So I want to emphasize that there is still a ray of hope that you can be able to, and many people who have died and whatever, many children have been helped in the public institutions. So
and
they
is
should
the
be able
government
to.
doing something about the fake medicines circulating?
Regarding issues of fake medicines, there is a statutory body which was established by mandate of Parliament to regulate and monitor issues of registration, access, and this is the responsibility of National Drug Authority. And they have got that all drugs which definitely should enter the country should be able to do one, should be registered. But as you definitely know that our borders are very porous, you'll still find definitely fake medicines find their way into one. But they definitely, they have a systems across the country where they do regular monitoring and checks. And through that, they have definitely been able to pick some of the fake medicines in the market.
And the people have been brought to book?
The people have been brought to book.
Okay.
Like recent cases of the hepatitis which we have had.
Correct.
People have been brought to book.
Correct. I understand that we have a question on the ground. Andrew Chamagere, if you can hear me, feel free to shoot the question to Daktari.
I have a question here from the lady. Mama Bakuitani.
Amanya gange Jali Namugerwa.
Jali yabuze ekibuuzo kyo ku byobulamu.
Ekibuuzo kyange kye mbuuza ku byobulamu. Kiri bwe kiti, lwaki tetukyafiibwako ku malwaliro? Tulwala ne tugenda mu malwaliro, omusawo buli gwoyogerako naye akuyitako buyisi. Kati twafuna obuzibu nga ffe abantu aba wansi. Bw'ova eno n'ogenda mu ddwaliro, omusawo agamba nze siina budde leero sinze nakoze. Ate nga ffe tuva eno nga tumanyi nti abasawo balina otukolako kuba batusindika mu malwaliro ffe ng'eno Nansana. Tujjanjaba mu malwaliro Wakiso, Nakule ne Kawempe. Kati bw'oba ovudde eno n'ogenda Wakiso nga bagamba lwaki ogenze ku Nakule ndaba liri bali okumpi. Bw'ogenda ku Nakule nga bagamba genda e Mulago nti wali ddagala. Bw'ova e Mulago tekyafiibwako. Kati Mulago bafa ku bano ab'embuto abali obubi ennyo n'aba accident. Naye nga nabo kutuusa mukolo kuba abatwana ne bateeka awo. Ffe juzi twafiibwa n'abaana ne tugendayo e Mulago nga bali awo wansi. Otegedde?
Well, there you have it. Director, her question is, what has brought about the change of attitudes among the doctors or the profession, the medical professionals? She says that there is a lot of blame game when you go to the hospital in Wakiso. They will tell you, why didn't you go to this one? And when you go to the other, and they're like, why didn't you go to the other? And so there is a lot of, being dribbled left, right, and center. And at the end, they're actually much more critical. They are critically healed. Mosei, what do you know?
Nze kimbadde mbuuza okendeeza okufuna obuyambi ku muntu owa wansi. Bamemba ba palamenti bakendedde wakiri ne baba nga 3. So kubanga sente zibatwala nyingi. So sente zizasigadde nizidda mu madwaliro gana amanene naga wansi ngafa gana mu byaro. So ntusobola okugendayo batujanjabe ne batatujjako enguzi. Okitegeera?
Yes. Well, there, Isma here has a solution. Mala, he says that why can't we just chop on the number of the ministers and the MPs, that there would be payment to them could actually be diverted to the Minister of Health, and we could have quality health care.
Thank you so much, Andrew Chamagero. Daktari, the first question about the health practitioners not handling, the patients in a professional way. So she said that you, for instance, go to a healthcare institution. If the first doctor that came into contact with you did not, take your case seriously, they end up misdiagnosing. And then when this is taken up later on, it becomes a blame game. Why does this happen?
Okay, thank you for the question. And it's unfortunate this has happened to the lady. As I mentioned in the beginning, definitely we have got a referral structure. So that if you cannot be attended in a health center free, then subsequently you should move to a health center for. And if probably your condition cannot be handled there, then you get referred to the next what? The next level. And I think that's what we want to streamline. Currently, you will find that people are jumping the referral system for conditions which probably could be attended at a health center free.
But many at times they actually jump because they feel they were not attended to well in this particular, you know, at that level of hospital they were in. So they feel like if I jump and take myself to Mulago, because we've had instances where people don't wait to be referred, they actually go ahead and take that issue in their own hands. They go to Mulago or a bigger hospital for that. It's because of lack of trust. Is that being sorted out?
No, this is what we want to try to change. So that we want you that, because that's why we always have challenges that the medicines are available at lower facilities and they are not, and they have got finished in the higher facilities because all the patients are going to the what? To the higher facilities. So we want to definitely address that so that we have a referral system. Currently we are reviewing our referral system both for internal referrals and also referrals abroad, so that we kind of streamline it so that if you have in, then you should be able to refer. And we are implementing a voucher system on a results-based results-based financing in 76 districts. And what will it have? It will have a referral voucher. So when you attend this facility, it will then you'll be referred, you'll be given a voucher and you'll be referred the next one, the next level. And what do we want to address with that? We want to improve quality and also improve efficiency. So that the facility gets paid for the number of patients which they have what? Attended. So if the facility is not able to up its service, then it will have the people will not be attending to it and you will not be receiving what? Receiving money.
I totally hear you, and I think then the sooner that happens, the better, because we've had instances where people wait to be referred, and by the time they're referred, they actually lose their lives, which is quite unfortunate. And I hope that will be sorted out as soon as possible. The other question is on how often does the Ministry of Health actually review the skill base of the health practitioners in these public institutions?
We have regulatory authorities. For the doctors, there is the Medical and Dental Practitioners Council, and is a requirement that every year before you renew your practicing license, you should have shown that you have hours of continuous professional education. So if you have not done that, then the council will not do what? Register you. The same thing with the nurses and also the allied health professionals and the pharmacists. Currently, as a country, we do not administer an exams like other countries. After a certain period of time, you undergo an examination to see whether you are still fit to do what? To practice. But probably in the long run, that's where we will need to move.
That's where you'll need to move. As we bring this to a close, maybe you can tell us, in a nutshell, what can we do as the public to ensure that we also help the Ministry of Health and all these public institutions to help us in return and to give us the best services possible, apart from prevention?
Definitely, that's where the public has the biggest role of what? The biggest stake is that first is the issues of that government has provided all the services. We want really that there's demand for them. There's demand for immunization. There's demand for other services, so that we do not have just these facilities existing by name. People should be able to utilize them. The mothers should attend antenatal in the hospitals. They should be able to deliver in health facilities, because if they deliver, then they have better outcomes. If the children are immunized, definitely you have what? You are able to prevent. Now there are almost about 13 preventable diseases which are immunizable. And if you do that, the cost of delivery services is much more or less. Prevention aspect is much more or less than actually finally when you get in what? Complications which need more complicated care. We have the human papilloma vaccine for girls of 9 to 8 years. The utilization has been very poor. This is one of the things which particularly for the female fraternity, this is one area where we need a lot of your input, that in order to address issues of cervical cancer, let's have all the girls at that age
Is
group.
it free?
It's free.
Okay.
It's free in free government. Issues of those districts where we have rolled hepatitis vaccination, let people embrace it, because the only way we can prevent cancer of the liver is through what? Immunization.
Correct.
So, and then definitely there are issues of nutrition, which is still in the hands of the population, because we know very well that there's a very poor outcome associated with the nutrition and disease. So we want definitely the public, it's nutritious food, they drink safe water, and then they use, the other aspect, they use the roads responsibly, because there's a very high burden of trauma in this country, and that's also draining resources. So instead of us putting these resources to do really very critical things, then they find that they get diverted to addressing issues which really would have been addressed by prevention.
So by and large, the public can only help out the Ministry of Health to execute its roles excellently by prevention. In anything that we do, in everything that we do, we ensure that we prevent and we ensure that we do not get sick at the end of the day. And if we do, then you are streamlining the process.
Particularly for those on which, if you are on ART, we insist that you are there to your medications.
Yes.
Because one of the prevention mechanisms is really for you to do one. If you want to avoid complications, take one. The same thing with the TB. Finish your complete your first line treatment for susceptible TB. Because if you fail to finish, then you get multi-drug resistant TB, which is almost 10 times more expensive to do what? To manage.
Okay.
So those are all things which the government, I mean the community and the population can be able to contribute.
So we hear you, Dr. Ri. Thank you so much for making time to come on the show. So by and large, the role still lies within us. Ensure that you're healthy, ensure that you take any preventive measures. If it's malaria, sleep under a treated net, as he says. If you're on the roads, ensure that you abide by the traffic rules. Avoid getting into accidents if you can, and ensure that you are a responsible citizen at the end of the day. But the government on its part is doing as much as possible to ensure that we have the health system in the public centers be streamlined and the service delivery grow to the excellence level that it should be at. After this break, we'll be having Tech Notes, so stay tuned.